Okay, in this little section, we're just going to talk about trach suctioning. Many doctors or ENTs will turn around and ask for this little sheet. This little sheet identifies the type of the tracheostomy that we actually have. They'll talk about the tube size, and then it'll tell you whether it's cuff or cuffless, and it'll turn around and inflate with air or saline and how much volume they're actually putting into it. And the most important thing is they're identifying the size of catheter is utilized and the depth of insertion that we're putting down. So that way we do not over insert the catheter and cause some damage down at the carina. So once we turn around and determine that, this will be taped up to the wall where the patient care is going to be held at. So that way, if you have any question about where you're going to insert your catheter to, it'll be marked up there. In your catheter, you're going to have a bunch of little markings to identify what you have. You have markings going all the way across. You got some solid bands, and then you also have some intermittent bands that are in here. If, let's say, the physician wants to insert to 8 centimeters and no more than that, we would count to 8 centimeters. We'll see it right here, and then we would insert that until the 8 centimeter mark. In which case, it doesn't have a band because the band doesn't start to about 12. And then once you got your catheter in there, you stop at 8, and then from that point you would go ahead and suction. 1, 2, 3. Slowly pull out, remove the secretions. Listen to your breath sounds. See how they sound. If the secretions are still really coarse and you can't get them out, you may want to apply a little bit of saline, and it will be just a few drops applying down to the little port. Once it gets down to the tracheostomy, you have a problem trying to get the saline down, you can actually insert your catheter down just a little tiny bit, about halfway down, and when you insert the saline, it will have a tendency of following the catheter, and it'll drop the saline drops right into the port, and then you can effectively suction the patient out. Sometimes it's still really thick, sometimes your tracheostomy is just barely enough in there. You may want to insert a quarter centimeter beyond that point to help remove or facilitate removal of secretions. At that point, you'll be done. You'll pull your catheter back with that little black marking all the way up to the little hub where the little catheter is at. I'm going to take it out just for demonstration purposes. Oh, I can't get one out. Let me grab another one here. Okay, I don't have one available. But you can see there's a little tiny hub right here. And at that little hub is where your catheter wants to sit at. You don't want it too far out. If it's too far back, like so, and you see the catheter up here, your tube is going to fill up with a lot of air because you have this little open port. If you insert the little black mark to that little hub area, it prevents the gas from flowing back, and you stop filling up air with inside your tubing and stay within your circuit for the most part. Thank you very much.